Beware of contaminated stethoscopes. Dr. Anthony Phillips was trained as an emergency room doctor. Over several years, his duties changed to administrator and educator at the medical school. Dr. Phillips did not want to lose his clinical skills as a physician, therefore he spent 2 days a month attending in the emergency department. Dr. Phillips arrives at the start of his 10-hour shift. Things were relatively quiet on this Friday afternoon, and Dr. Phillips was able to spend time with his patients. Then around 8 p.m., things got hectic in the emergency department, as they usually do on weekend nights. The waiting room is packed with patients suffering from various problems, including abdominal pain, chest discomfort, trauma, and infections. Dr. Phillips and the emergency department team systematically triaged each patient. In between patients, he cleans the stethoscope with alcohol wipes. Dr. Phillips is conducting a physical exam on Harvey, a homeless man whose right leg is swollen. After listening to his heart and lungs, Dr. Phillips suspected an infection and is in the process of ordering cultures when another patient, Gail, enters the unit. She is delirious and shouting at the first responders who brought her in. After a few moments, she calms down, allowing Dr. Phillips to conduct an initial physical exam. Due to the intensity of the moment, the doctor forgets to clean his scope cover. Inadvertently, he transmits a bacterium from Harvey to Gail through his contaminated scope. Later, Gail suffered from nausea, vomiting, diarrhea, and abdominal pain. A nasal swab is taken and sent to the lab. The patient tested positive for a resistant bacterial infection. She is admitted next day to the ICU. Dr. Wellington, an infectious disease epidemiologist, conducts contact tracing to determine how Gail got infected. He saw that both patients with MRSA were next to each other in the emergency department. He contacts the microbiology laboratory and requests that the nucleic acids isolated from the bacteria be probed and sequenced. The 2 strains are identical, leading Dr. Wellington to conclude that Gail's infection was hospital-acquired. As a result of this and other hospital-acquired infection cases, the hospital implemented a novel stethoscope hygiene program. Disc cover places a disposable sterile cover onto the chest piece of a stethoscope within 1 second. Devices are strategically mounted throughout the medical ward next to hand sanitizer dispensers. The hospital implemented continuing education lectures focusing on the transmission of viruses and bacteria from contaminated scopes. Dr. Wellington examines the rate of hospital-acquired infections before and after installation of disc cover and documents a substantial decline. Stay tuned for more lab tales.